Today we are at Uitenhage General Hospital. The Deputy Public Protector, Ms. Kholeka, Gcaleka, is here conducting an oversight visit at this hospital. She's on a two-day visit. She started yesterday at the Uitenhage Hospital, then moved to Livingston Hospital. Today she's moved here to Uitenhage General Hospital. She will be moving to Kholeka Hospital. Well, the Eastern Cape has been plagued by a number of issues, from the controversial procurement of the scooters to a shortage of PPEs at various hospitals to the high infection rate to the healthcare workers, and also another issue such as the lack of infrastructure and the lack of beds here at healthcare facilities in the Eastern Cape. Well, I was here last week speaking to the CEO of this very same hospital. He was saying they're operating at 60% capacity of this hospital because there's a shortage of bed, and also there's still a lack of infrastructural backlog. She was also saying that some of his staff members are overwhelmed by the work, they are fatigued. So the members of SANDF were here to try and intervene on that, to also try to ease the workload on the healthcare workers at Uitenhage General Hospital. So the Deputy Public Protector is here. She has been conducting this oversight visit. She has visited a number of wards to try and see what is the problem actually here at this hospital. But I will be bringing in the Deputy Public Protector to tell us about her visit here rather. DPP, what have you seen so far in your visit at this hospital?
The observations that we've made so far, ranging from the meeting that we've had with management as well as the staff represented by the union and the walkabout that we have undertaken, is that this is an old hospital. Thus, infrastructure is a challenge, particularly during this time. During the peak, they've indicated that it's been very difficult to observe social distancing. They also would attribute that to some of the staff infections that they've had, because they've had to keep many patients and staff members in the same area. There's also a challenge of PPEs, which one of the nursing staff even here at the COVID ward has just mentioned, which they also attribute as one of the risk factors to their infections. There's also a high vacancy rate ranging from middle management, senior management. The CEO is acting the head of clinical services. There's no head. There's a senior manager who's taking care of clinical services, which then makes it a challenge in respect of governance and administration of the hospital. So there is a leadership instability. There is also, the hospital has been in transition from a district to a regional hospital, and that has been from 2012 when they were gazetted. However, the infrastructure of the hospital is not in line with the required services that the hospital has to provide. As a result of the pressures caused by COVID, they have had to abolish some of the services that they have been providing to give priority to COVID patients, which actually means that your normal, what we would call normal patients outside of COVID patients, have then had to be neglected in terms of service delivery. So it has affected that part of service delivery.
So how is that impacting the work that is being done, and also the staffers here, since they are fatigued and overwhelmed by this work and this shortage of, how do you see that as an impact to the normal service to patient that has to be provided, the healthcare service that has to be provided to patients?
They've indicated that the staff morale has been quite low, and they have also admitted that it has hindered on the services. However, they've come across as quite a committed team, that despite all the challenges that they are facing, they've tried by all means to provide the services that they are able to provide. And the deployment of the SANDF specialists has also assisted them, and they have also capacitated them with some skills to mitigate the environment.